You open your VA file, see 3 quiet years, and your stomach drops. No appointments, no therapy notes, maybe no medication history that you can easily find. Does that blank space automatically defeat your claim? No, but it does need to be understood carefully. The mistake is treating silence in a record like a verdict. Your job is not to fill that silence with a better story. Your job is to identify what happened, what you can document, and what still needs to be verified. I'm Cameron Burrell, a U.S. Army veteran and founder of VetBiz Media. This is the Veteran Benefits Reset podcast, where we help veterans and their families understand the VA disability benefits process, one responsible step at a time.
Today, we're looking at what a treatment gap can and cannot tell you. We'll separate 3 situations that are easy to confuse, look at why care may become less visible, and build a simple timeline you can use before a conversation with a VA-accredited Veterans Service Organization, claims agent, or attorney. This is general education, not individualized legal or medical advice. Every veteran's service, health history, records, and circumstances are different, so we'll focus on better questions and better organization, not predictions. Veteran to veteran, facts over frustration, and education before action.
Let's start with the first distinction. The care may have happened, but the record you're reviewing may be missing. Maybe you went to a private clinic after leaving active duty, but the file you have only shows a bill, an appointment card, or a medication bottle. That is a records question. The next possibility is different. There really was a period when you did not seek treatment. No regular appointments, no counseling, no documented follow-up. That is a treatment history question.
And there is a third possibility. Care continued, but it changed form. You moved from regular appointments to occasional urgent care. You used telehealth. You managed symptoms yourself. You received refills without a detailed visit note. Or you changed providers, and the record stopped appearing in the same system. Those are not the same problem. A blank space on a spreadsheet cannot tell you which explanation applies. It is a prompt to investigate, not a conclusion to announce.
Why might treatment records become quiet? Did you move, change jobs, lose insurance, work rotating shifts, have trouble finding transportation or an appointment, avoid care because you were trying to stay on the job? Maybe. A veteran might also manage symptoms at home, rely on over-the-counter methods, or feel uncomfortable discussing the problem. But don't choose a reason because it sounds persuasive. Use it only if it is true for you. And if none of those explanations fits, don't force one into your history. Context can be useful. Invented context can create a different problem. The responsible approach is simple. Describe what you know, identify what you do not know, and leave conclusions to the appropriate review.
Picture a general example. A veteran leaves service, moves 2 states away, starts rotating night shifts, and pays cash for occasional appointments. 4 years later, the VA file shows treatment before the move and treatment after the veteran returns to VA care, but almost nothing in between. What does that gap prove? Only that the file is quiet. It may raise questions about providers, access, medications, work, and symptoms. It does not automatically explain the gap, and it does not automatically resolve the claim. The useful response is not to make the story sound stronger. It is to build an honest record of the timeline.
Take a sheet of paper or open a simple document. Draw 3 columns: facts, observations, and questions. In the facts column, write what a record actually shows. For example, June 2014, private clinic record, medication prescribed. In the observations column, write what you personally noticed, without diagnosing yourself. You might write, I changed shifts because mornings became difficult, or I stopped attending recreational activities. In the questions column, write what you still need to find out. 3 columns: facts, observations, questions. That separation keeps memory, documentation, and uncertainty from getting blended together.
Add dates, or approximate dates when that is all you know. Identify the source: service records, VA treatment, a private provider, pharmacy information, an employment document, or your own recollection. Then write only what that source supports. If you moved, changed jobs, separated from service, changed insurance, or changed providers, note the timing when it is relevant and truthful. Do not turn every life event into a medical explanation. A move is a move. A schedule change is a schedule change. Let the evidence and your first-hand observations speak for themselves.
Different evidence sources answer different questions. A VA or private treatment record may show a visit, symptoms discussed, testing, a clinician's assessment, medication, or a follow-up recommendation. A pharmacy record may show that a prescription was filled. It may not tell you why it was prescribed or how symptoms affected your daily life. An employment record may show a schedule change, attendance issue, accommodation, or job history. It may not establish a medical diagnosis. A statement from you, a family member, a coworker, or a friend may describe an observed experience. It is not a substitute for every kind of medical evidence. No single document automatically decides a claim. The goal is to understand what each source can show, what it cannot show, and what needs to be verified.
This is also where evidence mistakes can happen. Backfilling means taking a current diagnosis and casually placing it into an earlier period without support. Exaggeration means turning a complicated experience into an absolute statement. Copying diagnosis language from an internet forum can make your account sound unfamiliar or inaccurate. And overlooking information that does not fit your preferred version of events can weaken your understanding of the record. A note showing improvement, a normal examination, or a different description is still part of the evidence. If you know why something changed, explain it truthfully. If you do not know, say that. Lack of treatment is not automatic proof that a condition did not exist. It is also not automatic proof that it did exist. Both conclusions go beyond the blank space.
So what should you bring to an accredited representative? Bring questions rather than conclusions. You could ask, what records are available and what period appears to be missing? You could ask, does this look like a missing record issue, a period without treatment, or a change in care? Ask whether there are providers or facilities you should contact and whether you need to verify current authorization or request procedures through official VA resources. Ask which parts of your timeline are documented, which are personal observations, and which still need confirmation. You can also ask what information would help the representative evaluate the situation and what you should avoid assuming.
Those questions do not ask anyone to guarantee an outcome. They invite a careful review of the evidence you actually have. If you are reviewing a decision, filing a claim, or considering a review option, an accredited VSO, claims agent, or attorney can explain how current rules and procedures may apply to your circumstances. Verify current requirements through official VA sources because forms, instructions, and processes can change. Organizing your information is useful. It is not a prediction of a rating, approval, effective date, or compensation amount.
Before your next conversation, complete the one-page timeline. Write the period you are reviewing, add dates or approximate dates, name the source, record what the source actually says, add your first-hand observations. Then list the questions you still need answered. Include military records, VA and private treatment information, medication history, employment changes, and major life events, only when they are relevant and truthful. Keep track of where each fact came from and do not alter an original record. If you do not remember, write that you do not remember. Guessing is not organization.
Before you finish, circle the 3 questions you most need answered. That is your preparation. The page will not decide your claim, and it is not supposed to. Its job is simpler. Make the next conversation clearer. 1 step, 1 record, 1 mission.
Let's bring it together. A treatment gap is something to examine, not something to fear automatically. First, ask what kind of gap you are looking at. A missing record, a period without treatment, or a change in care. Then consider context without assuming. Separate documented facts from personal observations and unanswered questions. Understand what each type of evidence can actually show. And avoid backfilling, exaggeration, copied internet language, or conclusions based only on silence. Your next responsible step is to make the 3-column timeline. Then use it to review official VA information or speak with an accredited representative.
Stay organized, stay informed, stay ready. Your service did not expire. Your story is still worth reviewing.
Thanks for listening to the Veteran Benefits Reset podcast. This is educational information, not individualized legal or medical advice. Verify current requirements through official VA resources and consult a VA-accredited professional when appropriate. If this episode helped you, follow the podcast, leave a review, and share it with another veteran, family member, or caregiver. Download the free 7-step Veteran Benefits Reset Guide at vetbizmedia.com/veteran7. Thank you for listening to the Veteran Benefits Reset podcast. Your service did not expire. Your story is still worth reviewing. Take the next responsible step.